January 26th meeting of the Augusta County Commission. Please join us in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
I'm Tom Rolfe, Chair of the Commission, and I'd like to introduce the folks up here, starting on the my far left, Jenny Chambers, and Director of Public Works and Planning. And then we've got Grandy, who is our Recording Secretary for the day, Commissioner Andy Hunthausen, Commissioner Candace Payne, and from the County Attorney's Office, Nico Hash and TJ Murphy. And then finally, Roger Balls, our Chief Administrative Officer. There is a place to sign up if you would leave your name and a contact information there, as well as right near there is also a list of the items we're going to cover, an agenda for today. We have this morning a consent action item. Mr. Balls, would you like to present that?
Thank you, Mr. Chair and Commissioners. This is item 3A on the agenda this morning. Is vendor claims report for the week ending January 20th, 2026, and staff recommends approval of that item. Thank you very much.
Right. Are there any questions on that item, on consent action item? Any questions from the Commission? Is there any public comment on the consent action item? Any public comment? There being none, do we have a motion?
Mr. Chair, I move we approve consent action item 3A as presented.
Second.
Is there any further discussion from the Commission? Any further discussion? There being none, we'll move to a vote. All those in favor of approving the consent action item number 3A, vendor claims report for the week ending January 20th, 2026, please say aye.
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 Vote opposed, same sign. Motion carries unanimously. Next item on our agenda this morning is an action item 4A, task order between Lewis and Clark County and Great West Engineering. Dan Karlin.
Good morning, Mr. Chair and Commissioners. For the record, I'm Dan Karlin, County Engineer. For you today is task order number B106 for Great West Engineering to perform engineering services for the design of the Augusta Clemons Road Bridge over Elk Creek. Scope of work includes data collection, field surveys, owner and stakeholder coordination, geotechnical investigation, project design, hydraulic analysis, permitting, bidding assistance, constructor contract administration, and grant administration assistance. Task order is for time and materials not to exceed $269,000, and work shall be completed by February 28th of 2028. This bridge replacement is a result of a successful $750,000 Montana Coal Endowment Program, or MCEP, grant funded by the 2024 legislative session. The MCEP program requires a minimum of 50% match from the local jurisdiction. The county accepted a $793,700 grant from the Senate Bill 536 program in September that provides the required match, fully funding this project. The SB 536 grant program from the Montana Department of Transportation, or MPT, was established to provide matching funds to local agencies that received grants from other state or federal agencies. The project is included in the fiscal year 26 Public Works Bridge Infrastructure budget. Staff recommends that the Board of County Commissioners approve task order number B106 with Great West Engineering in the amount of $269,000 with an end date of February 28th, 2028. Authorize the chair to sign. A couple visual aids for you up there. This first one is kind of the whole county here, the whole general area with the location in reference to Augusta. See Helen at the bottom there. The second one is a zoom in of the specific road. That's over Elk Creek there. This is a portion that does flood when we get some very large events. And finally, I have here a little bit more detailed layout of what the bridge kind of looked like once placed. See, it's on a little bit of a skew and it's quite a bit longer than the existing structure there, as well as wider to accommodate two-way traffic. I can answer any questions you have.
If I remember correctly, the proposal is to expand the length of the span. You don't remember what the difference is?
Mr. Chair, Commissioners, yeah, so the existing structure is, I believe, 54 feet long from abutment to abutment. The proposed structure is 95 feet long, or in that vicinity. That exact span length gets dialed in when we do the hydraulic analysis. So we've got really good hydrology and hydraulic information for Elk Creek as a result of our 2018 and 19 flooding up there. But with that, you always have to dial that in order to get your floodplain permit and make sure that the new structure complies with all of the bridge standards.
Another question that have is, I recall this bridge is being replaced, is over 100 years old.
Mr. Chair, Commissioners, I believe this bridge was constructed in the 19 teens. So I don't want to get too specific. It's 16 or 19. Yes, it is. It's well over 100 years old. At that point in time, there weren't a whole lot of vehicles, and there certainly weren't the size of heavy trucks that we have today. They're also narrower, so this bridge only has about a 16-foot usable width. Our current standard is 24 feet, so this is significantly wider, definitely longer, and sturdier.
One other question. It seems maybe with that wider span, it might make it easier for the when we do get a flood at Elk Creek, to make it a little easier to keep it within the regular stream bed rather than pushing some off to the side.
Mr. Chair, Commissioners, so that's, we definitely do an extensive hydraulic analysis. We build what's called a two-dimensional model to look at all this, which we have. The specific thing you're mentioning, so at the locality of this bridge, right in that vicinity, yes, the water will do a better job of staying in. But the definition of a flood is above what we call the Q2, or the 2-year recurrence interval. And when that's the case, there's more water than fit in the banks. So you're still going to have water escaping stream banks upstream of this bridge. So you'll still have your spread out low-lying flooding still going to occur. But in the vicinity of this bridge, it won't be jeopardized by water going over the top of the bridge in that specific instance.
All right. Thank you. Are there any other questions from the right. I really appreciate your diligence in working for the state funding for this. It's an expensive bridge, and to think that we've been able to get grants to cover everything, including this design work. I appreciate that. Thank you. All right. If there's no other questions, is there any public comment? Any public comment on? There being none, do we have a motion?
Mr. Chair, I move that we approve action item 4A, the task order between Lewis and Clark County and Great West Engineering, as presented by Dan Karlin.
Second.
Is there any further discussion from the committee?
I'd like to make one comment.
Commissioner King.
Looking at this bridge, we've been up there and toured that and looked at it, and right now there's limited traffic on that bridge. However, the way our community is growing, and I'm sure Augusta will too, there's likely to be housing development out there someplace in the next 50 or 60 years. And by addressing the issues related to the bridge now, maybe it'll help move things along in the future. Help somebody with their project.
Any other comments? Any other comments from you? There being none, we'll move to a vote. All those in favor of approving the task order between Lewis and Clark County and Great West Engineering, as explained by Dan Karlin, say aye. Aye. Opposed, same sign. Motion passes unanimously. Next item on our agenda today is a grant application to the Montana Public Health Institute.
Good morning, Mr. Chair, members of the commission. I'm Sandau. I'm the grant specialist at Lewis and Clark Public Health. Today I have before you for your consideration a grant application to the Montana Public Health Institute for their capacity enhancing project funding opportunity. The grant period would begin once awarded and runs through June 30th, 2026 in the amount of $15,000. The purpose of these funds are to support local health departments in implementing projects that address and identify needs via a formal plan or assessment. Any of those assessments could be the Foundational Public Health Services Assessment, Community Health Improvement Plan, a Workforce Development Plan, or a strategic. It is a key component of Lewis and Clark Public Health strategic plan that we hear from our community that we serve to better understand their needs and ways that we can improve our service. Historically, we have gained this feedback through specific programs doing outreach to their clients, surveys, focus groups. As a department, we've done a survey and really promoted that survey every few years. This would be a way to unify that and make sure that we are really hearing from the people we are serving. Our epidemiologist has created a customer feedback plan that outlines how we can better get information and feedback from our community to improve our service delivery and access. This funding opportunity will provide funds so we can try the plan out. We would start with two teams, our home visiting team and our women, infant, child team, so WIC. Once we are able to hear from those teams through focus groups, through interviews, through a survey, we will also have some funds from this grant to be able to implement the changes. It's really key that once we hear feedback, that we're able to really listen and show that it matters by making sure that we can change as well. So some of the funds will help implement, hopefully, a change that we hear from these clients. This project focuses on goals outlined in our Lewis and Clark Public Health Strategic Plan and the Foundational Public Health Services Assessment. The application is due on January 23rd. Staff recommends approval, and here's the question.
Are there any questions? Commissioner Payne?
I have a few questions here. I'm looking at the timeline, the December 30th, 2025 timeline that was included in this presentation. And I'm a little concerned that some of these dates have already passed. For this quarter, applications will be accepted January 2nd through the 23rd, and I think they might be the 20th. And then the kickoff webinar was Friday, January 9th. Grant application office hours, January 12th and January 15th. Is that going to create a problem for the people trying to get to participate?
Yeah, thank you, Chair Wall, Commissioner Payne. It was a very tight turnaround, so they only have it open for those 3 weeks. We did attend that webinar and we did attend the office hours to talk to the funders. What an opportunity to say, what are you looking for? What types of projects? Be able to brainstorm some of our ideas and say, do you think this would fit your need? Normally, they have the cone of silence where you can't talk to them. So it's really a wonderful opportunity to say, here's our idea. What's your feedback? We were able to have that opportunity, and now it is a tight turnaround to make sure that it's written and submitted. And then it's a tight turnaround to implement because they want it done by June 30th. They did say they will have flexibility once we're in the contracting process, that maybe it could go past June 30th. but it is a tight turnaround, and the reasoning for having that tight turnaround is because they expect another funding cycle of the similar project to start in July. Thankfully, we feel like we're ready to run with this project. We have the customer service plan. We want to now implement it. We are ready to dive in and get the feedback. So as long as they can contract really quick, we feel that the timeline works for us.
And one other question. I don't recall hearing a lot about the Montana Public Health Institute. What the heck is the institute?
Thank you, Commissioner Payne. That's a great question. The Montana Public Health Institute is a nonprofit association where they have public health professionals, and their goal is, I wish I had their mission and vision in front of me, but their goal is to help support the public health system in the state in ways that maybe the state of Montana wouldn't be able to.
I understand the
Oh,
mission, I
okay.
just don't know who they are. Is this from the whole state, or is this certain counties, or is this 5 rich people with time on their hands?
Yeah, they're a nonprofit that helps serve the whole state. I believe they have anywhere from 5 to 10 staff members, and they offer training and funding opportunities and a few other things that any of the health departments in the whole state can apply for.
Where's their main office?
But, they're around the state, but I believe if they have a mailing address, I believe it's Missoula, but I know that their staff are located across the state in separate areas.
Thank you very much.
Any other questions? Any other questions from the commission? Is there any public comment on this item? Any public comment? There being none, do we have a motion?
Mr. Chair, I would move that we approve the grant application for Montana Public Health Institute as presented.
Second.
Is there any discussion from the commission? Any discussion? Any other? If there being no discussion, we'll move to a vote. All those in favor say aye.
Aye.
Opposed, same sign. Motion carried. Unanimous. We've arrived at the time in our deliberations where we offer an opportunity for public comment on any public matter within the jurisdiction of the commission, but not on our today's agenda. Is there any public comment? Is there any public comment? There being none, we're adjourned.